So my name's Nicola Wass, and I'm going to be chairing this panel discussion today. I think it's more of a conversation that we're going to be having, really, isn't it, than a discussion. But just to set the scene a little bit, yesterday we very much looked at the policy landscape of technology-enabled care, and that continued for most of the day until we heard from Bailey Abbott, the 11-year-old girl who 3D printed her prosthetic hand. And I think when you hear stories like that, it kind of really brings home to you, doesn't it, the kind of real impact that technology has on people's lives. Today, we want to continue looking at impact, looking at the doers of the tech world, people who are out there trying to make a real change and to make a difference. And you know, I'm really pleased to be here today with some doers of the tech world. I'm here with Steve Vaughan from the integration team at Welsh Government, Eddie Ritson, the Centre for Connected Health and Social Care in Northern Ireland, and Alistair Hodgson from Scottish Government. Some of you will have seen Alistair yesterday when he spoke on the former policy panel. He must have done okay because we've invited him back. So welcome very much. We're also joined to my right by Alyson, who you all know, and Alyson's going to be providing a little bit of a view from the TSA. So what you won't know from the intros is that Steve, Eddie and Alistair are not only representing their respective governments, but they're also members of a new think tank that has been set up by the TSA. It's bringing together the 4 nation states in the recognition that by working closer together, there's a real opportunity to share knowledge, expertise, insight, and very practical resources. So it seems like a really good decision. And part of this session is going to explore a little bit the role of the think tank and let you know how they would like you to be involved in helping shape their agenda. I think we've talked quite a bit about the fact that with some of the challenges that we're facing today, you can't sit in a room in government and expect to make real-world impact. You need to engage with the people who are delivering services, with the people who are creating technology, and with the people who are using it. So it's very much at the core of our thinking. We also, as we mentioned earlier, we want to hear from you. So there'll be an opportunity to pose some questions. So we'll be looking at Twitter, if any of you are still tweeting. And but also we'll ask some questions by sending some roving mics around. So if there are questions that you want to ask of the panel, if there are things that you think about that you'd explore further, this is your opportunity to do so. So if you're going to use Twitter, just a reminder to use the hashtag that you've been using throughout the conference. Alyson, I'm going to start with you, really, because I think one thing that's struck me is the way you've spoken really powerfully about your ambitions for the TSA, not just to be, I suppose, a coordinating organisation, but actually a real resource for the sector, a catalyst for change and innovation. Why, Alyson, were you so keen to perhaps set up a think tank for the TSA?
The past 2 years in the TSA, when we stood on the stage at the conference in 2014, I suppose the TSA needed a new purpose. Exactly what did we need to do, not only for our members, but what did we need to do for the whole sector? And I think that's been well received, but we really needed to look at ourselves about who we were and what were we going to do, what was our ambition. And our ambition is to be the voice of technology-enabled care. That's what our members want. You can't be a voice of the industry of technology-enabled care unless you engage, unless you partner, unless you collaborate. Now, the purpose of the think tank, when we stood on this stage last year, although I did have lots of conversations with Scottish Government, Welsh Government, the work that we're doing with NHS England and Northern Ireland, what we didn't do was bring that collective learning together. And it was amazing yesterday that when we talk about our mission, the mission 2 years ago was to lead this industry. We've just changed that mission, saying together we need to lead this industry. And we can't do it unless we've got our member states on board, understanding their needs, understanding how we can change this sector. Now, yesterday there was lots of conversation about this, about how we do it. Today, we need to come to some solutions about how we are really going to do it and how we're going to engage with our partners. So it's been excellent to bring the think tank together and get that buy-in from the 4 member states.
We should also mention that Paul Rice was due to be here, stood in yesterday, so sends his apologies, but we are actually a 4-nation think tank. I think it's going to be really interesting to explore a little bit more what we mean by think tank, our thoughts on it, and what we want to achieve. But I guess it's also useful to spend a little bit of time first just talking about some of the work you guys are doing in your various kind of governments and really, I suppose, things that you think is going to be of real interest to the audience. I'm going to start with you, Steve. You ran yesterday a session on benefits realisation. I hear it went very well. And I know this is a really flagship piece of work for Welsh Government. What can you tell the audience about that work that's happening?
Well, the work started because in Wales, we've got established telecare services throughout Wales. Telehealth is much patchier, if you like. And I think there was a realization that we needed to reinvigorate our approach to technology-enabled care. And we do have a learning and improvement network which met over a year ago, and I think the decision was taken that we needed to move things on. And interestingly, when we had that first meeting, the TSA, Alyson turned up to that meeting, and we were trying to think of the best way of actually making progress. And it was the TSA suggestion of a benefits realization approach, because there is, opposition. When I came to the TSA conference for the first time last year, I was quite surprised, really, at the frustration expressed by industry that they could never scale things up, that they were stuck in pilots. And, so we did want to move things on. And I think a benefits realization approach enables us to go to various stakeholders, whether they be policy leads in government, in health, social services, housing, whether they be local authorities, a health service, various professionals, and indeed users and their representative. It does give us an advantage to say, well, this is the benefits, this is how we can use technology-enabled care, this is how we can find solutions to improve the quality of your life. So that's been extremely valuable, and that's what we've focused on for the last year. I would like to pay tribute to the TSA in this sense, in that when we started work, and I let it be known that the TSA was supporting this work, we have our own expertise in Wales as well, people like Kevin Doughty and our managers who are working this on a day-to-day basis. But there was suspicion because, well, the TSA, is industry driving this, or is this Welsh Government? I can honestly say that I valued the contribution of TSA because it's not been about pushing products or whatever. It's about trying to find the best solutions and put in place the appropriate mechanisms and infrastructure we need to take it forward. So I would say, I'm a little modest about this because I think our benefits realization plan is trying to put us on a proper business footing. We're probably a little way behind some of our colleagues in the other UK administrations. But I think if we're going to realize those benefits, we have to put in place the right infrastructure in terms of governance arrangements at the level of Welsh Government, within our health boards and with their local authority partners. And I think once we've done that, then we can have an integrated approach so we can achieve the synergies about technology-enabled care. Then I hope we can make progress.
Fantastic, thank you. Same question to you, Alistair. What work are you doing that you think the audience here would be keen to learn about?
Well, I think in Scotland we're not actually in too dissimilar position to Wales, and I think you do yourself a bit of a disservice when you say you're a bit further behind us. We were probably in the same position maybe 2 years ago when we've had a national telehealth telecare delivery plan for several years now. But it was very much an unfunded delivery plan. It was a case of us setting out what we wanted to do at a national level and what we hoped local partnerships, health and social care partnerships and housing associations would do at a local level. But as I say, it had no funding attached to it, so it was very much a case of what funding can local areas access themselves. We carried out a review of that maybe 18 months ago, and it was very clear that in the absence of any kind of national support, national infrastructure, that a lot of our expectations and hopes for local areas were not actually progressing at all. That wasn't through a lack of effort and a lack of willingness. It literally was down to a lack of capacity and a lack of finance. So we were quite lucky actually within the Scottish Government that we were actually able to attract a fairly significant amount of funding to the tune of £30 million over a 3-year period. And we're halfway through the first year of that funding cycle now. But once we were able to attract that funding, we then had to start looking at ourselves in terms of the national infrastructure that we had in place. And one of the things that we do quite well in Scotland is engage with Europe. We have a very strong network with various European partners, and we're engaged in quite a few different European programs. One of those programs, which I've previously talked about at TSA regional events, was a program called Momentum. Momentum was looking at what is required to upscale the approach to, in this case, telemedicine. And it came up with 18 critical success factors, which were all evidence-based, and most of it, you would say, were relatively common sense, things about having to have effective leadership, the right infrastructure in place, your right financial sides of things. So all fairly common sense, but every single one of those success factors were all evidence-based and thoroughly researched. We then decided to adapt these critical success factors to look at technology-enabled care in this broader sense rather than a slightly narrower telemedicine, and actually use it to assess our readiness to scale up across Scotland. And whilst there was a few gaps that we identified, the biggest gap that we actually kind of looked at from a national perspective was the ability of local areas to do effective business planning. I think that's an area that I think we struggle across everywhere in the UK really, is actually, yes, we know how effective telecare is, for example. Yes, we can point to some really good evidence, but actually we're not particularly good at shouting about that to non-telecare people and actually getting our respective local authorities or whoever to release more of their core budgets into these services so that they can actually start seeing the benefits across various different services. So we're now at that fairly early stages of identifying how we can best support local areas to enhance their business planning capabilities. We're looking at a tool called the Business Model Canvas, which has been used for a number of years in the private sector, and in the last sort of year or so it's starting to gain traction in the public sector. I know there's a colleague here from Sweden who's used the Business Model Canvas previously to look at how Sweden can make that move from analog telecare to digital telecare. There's a few other examples already in the healthcare system. So we're very much upskilling ourselves at a national level so we can understand the Business Model Canvas approach with a view to then going into local partnerships and providing support to them to do some of that business modelling, whilst at the same time releasing some extra funding to them so that they themselves actually have the capacity to do this properly. So I think, we're not a million miles away from what Steve's doing in Wales. Yep. Okay, we're coming at it from a slightly different angle, but the bottom line is it's about how we at a national level can provide as much physical hands-on support to kind of local implementation. So that's probably the main thing that I think is
And I think it would be unusual, I suppose, to be here and hear you talking about very different things. I know there's regional differences, but there's also great commonality and shared challenges. And incidentally, I love the Business Model Canvas. It's a really fantastic resource. So people here use that. Have you seen it? There's various canvases. It's a company called Strategizer developed it. I'm sure, Alyson, we can put a link on the website if people want to look at that. Eddie, Northern Ireland, tell us something about what you're doing in Northern Ireland.
Yeah, well, I first got involved in this whole agenda, I think about 7 or 8 years ago. Yeah. And one of the first things that somebody said to me was, the difficulty here, Eddie, is that most of the change you want to do is pretty much usually in the interest of the person, the patient, the client, the carer, yeah, but very rarely in the interest of the caregiver, the professional caregiver. Because they have to change, and that's a challenge. And certainly this feeling of, I'm not quite sure how you would describe it, dissatisfaction maybe from industry, that we've got all the products, we know they work, we see the great market opportunity, but bugger if we can get the products into situation, into use. And that frustration has been going on for many a year, almost to the extent I'm beginning to feel guilty about it. As someone who sort of should be leading policy in this area, obviously I'm not working hard enough or not having enough success. I think when we look at Northern Ireland, I see a place which is now actually at a great starting point because, and they're fairly simple things. I think firstly, there's a much wider and deeper understanding of a very simple bottom line, which is that we simply can't go on providing care for people in the way in which we currently do. There isn't enough bodies to do that. And the fact, I think that's something which maybe has been talked about for a long time, but I think there's a greater and greater understanding that that is the case. So that's leading to the idea that we need to change. The other thing which I think is coming more to the fore is this notion about innovation and information. And somebody coined the phrase that data is the fuel of innovation, which sort of stuck in my head a wee bit. That's really quite powerful, actually. Data is the fuel of innovation. So if you take that seriously, then you begin to value data, you begin to value information, you begin to value what you can do with it. And the other sort of very simple and general point, which I think we've reached as a system, is that strategies are virtually useless. Strategies come and strategies go, but without some sort of serious implementation plan or an idea about what to do, the strategy doesn't count for very much. So I think they're very simple things, but I think that's sort of a description of maybe where we are as a system. We have developed an e-health and care strategy recently, which is a strategy which lives in support of other health and social care transformation plans. And the strategy has 6 objectives. I'm not going to go through them all. But of note to me, the first objective in the e-health and care strategy is supporting people. And I thought, well, that's a good marker. And another of the 6 is fostering innovation. I thought there's another good marker. So we have an e-health and care strategy, which you have to read through it with a fine tooth comb to find something about IT. It's really about how we can use the technology to improve what we do. So I think that's a bit about where we are. We've been investing strongly in our approach in recent years. We're moving on with developing infrastructure. We're moving on with our engagement of professionals in the leadership process. I think that's vital, because unless we engage professionals in that, nothing will actually happen. And we've been putting in place some really solid core systems which will lay the foundation for the next stage.
Thank you. It's a kind of what you were saying about people and how technology really needs to respond to the user's needs. Think about how it enhances their experience. It reminds me, I was in conversation with somebody yesterday over break, and they were going, for me, it feels like it's less about technology-enabled care, it's more about technology-enabled lives. And I think we can all be committed to that idea of the individual and changing the individual's lives, albeit at a time of great challenge and constraints on our resource. Then I think we're probably heading somewhere in the right direction. So thank you, Eddie. I asked Alyson before about what was the trigger, what was the motivation for the think tank? Why did the TSA feel that it was important to set up a 4 nation-states think tank? But it doesn't really tell us, does it, what a think tank is? So I'm going to put Alistair on the spot. Now, you were smiling there, Alistair. You were just getting comfy and relaxing. But, okay, so Alistair, tell us, what is your definition of a think tank? I didn't give them the questions in advance, so they really are on the spot today.
Well, that's a very good question. I mean, to me, a think tank is an opportunity for, this is going to sound relatively glib, but it's an opportunity to come in and just talk about shared challenges in a closed, safe space, really. I think quite often we come to events like this, and obviously this is very, very public, but sometimes we want to be able to discuss some things in a more private environment, and I think the think tank is a good session to do that. And then it allows us to have a kind of a common approach to how we then tackle our shared challenges across each of the 4 nations. I mean, I don't think yes, each of us have slightly different ways of tackling slightly different issues, but by and large we're all trying to tackle the exact same problems in fairly similar structures with fairly similar personnel, all doing fairly similar things. So it's definitely an opportunity for us to kind of draw on our collective strengths. So
it's a safe space to come together and share your collective knowledge. But I guess for me, I don't know, I think about the word think tank sometimes, and it can have a slightly negative connotation, doesn't it? It sounds like you guys are the smart ones in the room, and maybe you have all the answers. Is that the case, Eddie? Do you have all the answers? Does your think tank have all the answers, or...?
Well, the word tank gets me, and I'm not quite sure if it's like a decompression chamber or a fish tank or a thing with caterpillar tracks and a big barrel out the front of it. I think what I'm looking for from a think tank is, well, what I'm not looking for, by the way, is a work program. Right? I've got enough work to do. I don't need somebody else to be accountable for a piece of work. But a place where there's a source of knowledge, a place where there's elements of peer support, a place where there's an opportunity to exchange ideas and practical ideas about solving real-life problems. That's a useful thing. That's something I'm prepared to get on a plane and fly over for. And I think if there's an extent to which, from a TSA perspective, that they can roll in behind some of that thinking with some practical measures. It may be around how we go about compiling information, compiling evidence, whatever it happens to be, making resources available. I think if there's some practical steps which the TSA can take to support the think tank, that would be a good thing.
I think that's really important, isn't it? Because whilst there's a lot of knowledge and expertise that is held in that think tank, there is also a hell of a lot of knowledge and expertise that people in this room hold to solving some key shared challenges, and people who aren't in this room but also bring a lot of insight, a lot of knowledge, a lot of resource into solving some of the key challenges that I guess we're all facing. And I was really interested to see, because we tried to have some conversations, to have some open conversations using the tweet chats, didn't we? And I think we had 1,200 people engaging at around that number at each tweet chat, wanting to participate, wanting to contribute their ideas and their knowledge. So I think it's going to be really important for the think tank to think, I guess, how do we harness the collective knowledge, expertise and resource that exists, not just within the TSA membership, but further and beyond. And that's going to be a key piece of work, isn't it? And I think something perhaps, Alyson, that you at TSA can help with. How would you mobilise your membership?
The members are all sitting in the room today, and the members that unfortunately couldn't be at the conference today, they're just waiting for this opportunity to be able to share their expertise. There's experts within the supply sector, the service providers they don't often get the chance to explain what they want, how they can do it, and sometimes they need a safe place as well to be able to come to government and to the think tank and really share all of that and really innovate. So I would like to create that space for TSA members, but our partners. And I think we've done really well in Wales, coming together over the last 12 months in the Benefit Realisation Plan, bringing all those different partners together. And it was difficult at first, wasn't it, Steve? Getting the common language between everybody. What did we want to achieve? But together, I think we have got there. That's the space that this can do moving forward. TSA will bring in the partners. If we haven't got the right partners in the room, we'll go out and collaborate to make sure that they're there.
So extending the network, really,
Yeah.
isn't it? Extending and connecting the network. Steve, you were at our first think tank. Can you tell me what are the benefits that I guess you'd really hope to get? We've heard about what Eddie's hoping to get out of it. Not too much work on his plate, but an opportunity to really share ideas. Steve, what are you in it for? What do you want?
Well, I don't come to the think tank as any kind of expert, really. I see myself as a glorified pusher and shover, right? And I think, I'm convinced that technology-enabled care can add significant capacity to health and local government, housing and social services. And so that's where I come from. And I think in terms of the conversations we started with, we've all got these common themes, aren't there? We're trying to make sure we've got the right strategies in place, the right infrastructure in place, taking Eddie's point, how we implement it, how we engage. There's a huge amount of learning to be done there, shared learning. And there are also issues which will face government. It faces people in health and social services every day, but there will be particular challenges over and above just improving outcomes for users. Government will be under pressure because of delayed transfers of care has been in the news. There's enormous pressure on frontline services. There's pressure on care homes. How can we support those frontline services? So getting together just helps us share some of those pressures. And the other challenges, of course, is that our public are in danger of overtaking us because they're tech savvy, and services are often having to catch up with that. It's not just helping the older person who has got no knowledge of technology. That's another challenge for us. And just keeping a pace with the sheer amount of information and change, that's the value, I think, where the think tank can work, but it has to work in conjunction with industry, people like the TSA, and indeed calling upon the experts here in the room.
Yeah. And you mentioned the word challenges quite a lot. The challenge of the technological advancements that are happening, outpacing, I suppose. Certainly, I work a lot with the public sector, their ability to kind of pivot and shift and embrace the new technology. The challenges of, obviously, the resource challenges that we're facing, where we're having to do more for less. What other challenges are the ones that you kind of found some common ground on at your first meeting in August? Steve, I don't know if you want to share a particular challenge that everybody felt, yes, this is something we would like to kind of collectively really start to unpick and to use the membership to kind of adapt and refine our understanding of how we might solve it.
Well, I think we're going to talk later, aren't we, about things like communication, language.
Yeah, tell us about that. Tell us a little bit about that now. Just to explain to the audience, we're sat here having a conversation on stage with ourselves, but we want to use the conference as an opportunity to open out that conversation and have a broader conversation with you. So this afternoon, we've managed to get a couple of rooms at the time when the panel sessions will be taking, not the panel sessions, apologies, the parallel sessions will be taking place. And really today, some of the challenges that we're going to come on to talking about now, we're saying to you, look, if this is your challenge, if this is something that you think is important and you have something to say on that, something to contribute, then come along and sit in a room with us later, and we want to carry on the conversation that we're having now with you, very much broadening that out. But you picked up on something that I think, I hear a lot about, and that's about kind of this common language. I'm not from the sector, and at first I was like, is telehealth, telecare, technology-enabled care, digital health, the list goes on. Why is that an important challenge for us to kind of try and get some common ground on?
I think if you were to bring the average man or woman off the Newport omnibus or whatever and bring them into a health and social care setting, often we could alienate them just by jargon. And I think the capacity to do that is even greater when we're talking about technology-enabled care, because inevitably a lot of it's innovative, a lot of it's new, it uses technical language, and it can put people off. And so I think that, if we're going to try and convince the public of the benefits of TECS, if we're trying to convince professionals, clinicians, frontline workers, caregivers, if we're going to convince them, then we have to have an accessible language, really. But I should stress, myself and Alistair just talked about this very briefly yesterday, I don't want it to be caught up in a kind of political correctness. I think we've had this in the past, whether we're talking about terms we use for people with a disability, disabled people, or whatever. And sometimes people can be afraid to open their mouths if they feel that they're going to be attacked. So we don't want it to be in a form of kind of political correctness and people fearful of getting things wrong. But we do need to have a way of communicating about TECS which is accessible and understandable for people.
I think Paul Rice was here yesterday on the panel. I don't know if you caught it, but he said, I think he said something along the line of, this agenda will not succeed if we don't improve our ability to clearly and concisely communicate the benefits. Would you guys kind of agree with that? Is language really important in the context of what we're trying to achieve?
Oh, absolutely, without a shadow of a doubt. Without a shadow of a doubt, I think the move from telecare, telehealth, telemedicine, telecoaching, tele
everything, isn't it?
Into that much more umbrella term of technology-enabled care, I think is a start. It's a positive start. It still doesn't, for me, pick up the idea of self-management and people using self-help apps and technologies, because this is very much about the technology we're providing to you to help you manage your own condition, whereas actually what we need to be doing is moving much more into that preventative approach where people are actually encouraged to go out and look for these things, these technologies, these approaches themselves, and actually use them themselves before they ever need to come into contact with public services. And until we get that shift, then I think actually the language is still, going to be largely a moot point, because we're still going to be fighting against the tide. But it's definitely a start moving to that broader technology-enabled care. It's much easier to understand. It's much easier to communicate. Whether it's the right terminology ultimately, I don't know. It might be too early to tell. But it's definitely a start.
Yeah. And if you have any thoughts on that yourselves, then there will be an opportunity shortly to ask some questions and to comment, I suppose, from the room. So we have language, and we have something that people can get hold of, people can use to kind of start the conversation and to try and find out, I suppose, what the users want, how we can meet their needs. But there's also something about the culture, isn't there, that we're operating in. Really kind of not just thinking, how do we deal with the tech? It's kind of, where does it fit into the big picture? And are we really starting to see tech within the big picture? Are we still seeing it as a little separate thing that we need to kind of create policy and strategy for and leadership on? Eddie, how do we create a more, I suppose, how do we change the culture where to raise a profile of technology and make sure it's in everybody's lives?
Well, we had that comment yesterday that, strategy eats culture for breakfast, and I think most of us would agree with that. And I think, culture is obviously really important. I think that concerns me slightly, something about culture, is, any major change program that starts with the lines, the first thing we need to do here is change the culture, quite frankly, isn't going to work. I'm a firm believer that it's behavioural change that leads in turn to embedded changes in culture. Picking up on some of the things that were said yesterday, what I heard actually were some strong sort of contradictions that we haven't really squared off yet. So, for example, we had this talk about, there was a sense that proactive care was a better thing to do than reactive care, and maybe a sense that many people would actually agree with that. But the challenge seems to be about the benefits, because the benefits are too fragmented, too distributed, too long-term, too hard to get to, too hard to size and quantify in a business case. So there's a contradiction, a tension around that. We want to do it, but we're sort of a bit stuck. Another contradiction that I heard was about risk. And somebody said, well, the risk of doing something is probably a smaller risk than the risk of doing nothing. I thought, well, that's fair. But it doesn't really seem to manifest itself. And my thinking about that is that actually doing nothing is easier. Because if you do something, say I do something, you're all looking at me, I'm accountable for that. All of a sudden, I'm the person who's sort of feeling the weight of that risk. Whereas doing nothing, well, sure, it's all spread around the place. We can all hide in anonymity, and we just deal with the problems of the day. I think that's another contradiction.
It's interesting though, isn't it? Because working in the private sector, I've worked in the private sector, the public sector, the third sector, and the appetite for risk and the approach to risk is very, very different, isn't it?
Well, it's valued there. It's a valued asset.
Yeah.
I think in the private sector more than perhaps it is. And that is a cultural thing.
And in the private sector, I found more about this kind of idea that, we can take risk. And it's okay to fail, but fail fast and learn. Whereas sometimes in the public sector, I don't know what you think, Alistair, it's almost as if we've invested in this, we've done a pilot, we're wedded to this, we cannot fail. And it's interesting kind of seeing that different approaches. Where do we need to be now, Eddie, in terms of that approach? Where should we sit? Because obviously we have people's lives as well, don't we?
Well, I think we need to build some behavioural change to force that behaviour adoption to happen more, and we could do that. I can think of some ways we could do that. But the third contradiction I spotted yesterday was actually about innovation. Because we are not short of well-intended, well-motivated people who come to work with the objective of either improving the health and care they give to people or improving their own working lives. But the system we wrap around them is overly bureaucratic, too inflexible, too slow to change. We don't support the innovative processes enough. And so the system says we want innovation with one hand, but with the other hand, we're putting in place, bureaucracy and rules and regulations which stymied the very innovation that we want to see.
Some of the cultural antibodies kick in, don't they, sometimes?
Well, I think we've got these contradictions, and I think what we have to do is to develop an action plan, a behavioural plan, not a cultural change plan, but a plan to actually address some of those contradictions in real terms. And through that, we'll get the cultural change that we want to see.
Okay. So that challenge was very much focused around culture, but also about helping improve the capability, capacity, and appetite for risk. in the public sector to enable innovation to happen.
Yeah.
Alistair, yours was more, I guess, we also talked about a very general one, quite a practical one, wasn't it? Which is how do we share this collective knowledge, insight and expertise? And I know we've talked about that a little bit with the think tank, but I think that's not a conversation that we can just have here on the stage now. It's about involving the wider membership. What was that challenge, and how would you kind of set that out?
Well, I think it was very much about recognising the fact that there's a huge amount of expertise, it was alluded to earlier, a huge amount of expertise across the whole of the UK. But I don't think any one locality has absolutely cracked this agenda whatsoever. But everybody individually probably has cracked different bits of the jigsaw. So it's about how can we actually pool that collective knowledge to our kind of the universal good, if you like. And when we used to be very good at that in Scotland under our previous large funding programme. We had a telecare learning network when we got everybody involved in developing telecare together on I think it was a bi-monthly basis, and they were talking about their shared challenges, how they overcame a particular procurement issue or went through their privacy impact assessment, etc. And actually it was, people were coming on a journey together. But when that particular programme ended, so did the network. You know, we still have an annual conference and an annual learning network exchange thing, but that's once a year. It's by no means the same impact as doing it on a bi-monthly or even a monthly basis. And that was only in one geographical area, that was just in Scotland.
Yeah, I mean,
we were not picking up on any of the expertise in England, Wales or Northern Ireland at all. Since then we started doing something kind of similar on a European level, so we're now doing exchange visits to different regions in Europe and seeing how they're doing it. But again, we're not doing that to go into England or Wales and Northern Ireland to see how our colleagues in a much closer and a much more aligned healthcare system are actually addressing some of these things.
That's a real challenge for the nation, isn't it? If you're coming up with great ideas in Scotland, but Eddie, you're struggling with similar challenges in Northern Ireland, and we're not sharing that, and we're not finding out ways to facilitate sharing that knowledge.
Well, we're very happy to share it. Sorry. We're very happy to share it across the Celtic fringe, but I'm not quite sure where the English are at. You know,
I always think people in other administrations, I always find people incredibly generous and willing to share. And I don't think this is in the political spotlight. I think it is unfortunate where the advantages of devolution is that people try things in different ways, and that offers different learning opportunities. The sad thing is when politicians make hay in terms of trying to compare the strengths and weaknesses of one system against another. But I don't think we're in that territory with technology-enabled care. No. It doesn't got the same spotlight. But I echo what Eddie was saying, really. It's much easier to defend the status quo. You know, even when you've got a service which is passed well by its sell-by date, nobody seems to question that. But if you come forward with a new idea, it's how many bed days is that going to save, and where's your business case, and so on and so forth. It's very difficult sometimes to innovate. Particularly when you're building things up from the start, when you haven't necessarily got that right infrastructure in place. So I would like us to focus more in terms of the solutions that can be offered by technology and care, enhancing and adding value to other care that's provided, and how it can mitigate risk. I think that's the language we need to get into.
Yeah.
20 years ago when we had the community care reforms, there was a big effort to get people to stop talking about Mrs. Jones needs home care or Mr. Jones needs a care placement. Nobody needs home care, nobody needs a care home placement. People have a range of needs which home care may be the most effective way of addressing. But I think the same thing with technology. It offers us a much greater suite of solutions to enhance care, and I think that and how it can mitigate risk is what we need to bring to the fore.
Okay, thank you for that, all three of you. What I want to do now is just to throw out the opportunity. You've heard us talk a little bit about the think tank, the purpose, the drive to make it not a conversation that happens in one room in Manchester, I think that's where we last met, but actually becomes a much bigger conversation with the whole sector. We've talked a little bit about some of the shared challenges around culture, challenges around sharing knowledge and resource, and challenges around common language and definitions and key messages that we send out. So I guess really, I wonder if you in the audience have any questions that you want to ask of our panel around those themes, or indeed around anything else that you've heard over the course of the last 2 days. So we should have some roving mics, yes? Yeah, and has anybody got a question they want to ask our panel? Have you just put your hands in the air now and somebody will come to you with a microphone? Okay, let's get a microphone there, please.
It'd be great to be able to see them, isn't it?
Good morning.
Good morning.
Steve Barnard. I'm a little bit frustrated. Hello, Alyson.
Hello.
Hello, Steve Vaughan. I'm a little bit frustrated and tired about hearing about this is added value, technology and stuff. If we think of how do we give people independence, how do we make them mobile, how do they communicate, this is stuff that we've been talking about for years. Technology just helps us do that and achieve that. And so we shouldn't be defining technology-enabled care. It's just how we provide the best support for people. Technology helps. You wouldn't take TVs out now as some added value. It's essential. So I'd just ask you, please, to stop talking about this as added value. It's not. Thank you.
Okay,
Good
we
night.
I think there was a question in there. There's also a lot of...
Could I respond to that? No, I think that's right, actually. One of my preoccupations is that it is part of the mainstream and it is built into the processes, so people think of it as a matter of routine. But we're a long way from that in terms of getting all our frontline practitioners to get up to speed to be able to do that. So one of my concerns, if you look at an example of somebody who perhaps is severely disabled, they're going to need a whole range of inputs in terms of they may need a communication board, they may have a powered wheelchair, they may have environmental controls, they may well benefit from technology-enabled care, and at the same time, they're going to need some personal direct care. All that has to come together. And so I accept the correction. It's not just about adding value. It is part of the mainstream. So it is considered as a matter of routine. So thanks for that.
Thank you.
Yeah,
Does anybody else want to come in on that?
Yeah, I would absolutely agree with that point. I mean, my personal goal is that the language of technology-enabled care, even though we're talking about shared definitions, actually disappears entirely within however many years it takes us. So it is just become a routine part of care. But much like Steve was saying, at the moment, in many, many areas, it's a fringe bit. You get your social care or you get your telecare. You don't get your care package that is put in to support you. And until we are actually able to bring the use of technology into that standard kind of operating procedure within different areas, then it is going to be seen as something different. But our goal certainly within Scotland, that I know is shared elsewhere, is very much to move it into that kind of mainstream business as usual. And when that's achieved, then it is just part of the packages that you can provide, and the actual language around about it disappears as a result.
Thank you.
I think what I would like to say is when we started conference yesterday, we talked about the vision of TSA, and that's about enriching people's lives. That's not just when it goes into services. That's not when we just need support from government. It's about the whole culture, what people want that for their lives. It's normal. It's normal to accept technology is part of your care for the future. So that's what I would like to achieve, not purely into the public sector, not just into a care plan, but public wanting that, to aspire to have that as part of their ageing.
Yeah. Thank you. Thank you very much. Do we have any other questions from the... Yes, gentleman on the second row.
Right at the front.
Hello, Adrian Heald from Cheshire. I work as a physician in the NHS in hospital, and what I see is huge advantages in terms of what we do in hospital and how we manage patients from what you've talked about today. Something I've discussed with Eddie when I came over to Belfast was how we can look at the health economic metrics in terms of how this will benefit the taxpayer ultimately with regard to certainly not having any additional costs, but potentially cost savings in certain areas. And what I would like to understand from the panel is how we can best view objectively the cost and health and social care benefits of this as we go forward on a larger scale than just the individual. I think it's a challenge. It's a challenge for us in health, but particularly when you're looking at quite a complex web of solutions, how we can best understand how the benefits are accruing over time in terms of less hospital admissions, shortened stays, and ultimately for us, keeping people safe in their own environments at home.
Eddie, you started that. You've had this conversation. Do you want to pick up on it a little bit now for us?
Well, clearly, if I'd known the answer, Adrian wouldn't be asking the question about told in Belfast. I think I have a secret, and my secret is that I know how to run the best health and care system in the world. And because I'm absolutely convinced that if you do, the right thing to the right person at the right time, making decisions based on the right information, that you will provide an individual with the best quality care that individual can get. And I'm absolutely sure as well that if you do that to everybody, you will provide the system at maximum efficiency. And I know that when you don't do that, what you end up doing is putting a problem off to another place or another time or another location where you disadvantage the system, you disadvantage the person. So we can see it at a micro level. Do the right thing for the person is the right thing to do. And we should subscribe to a philosophy that says if we do enough of that, it'll tick the big box. And we should all just walk away and just do that. The difficulty, I think, comes in the whole bureaucracy of business case, plans, benefits realizations. It's how we put enough packaging around the thing that we want to do so that if we do enough of the micro stuff, we can point to the macro benefits and that will in turn justify the investment. And that's the bit where we're really most stuck.
Okay, thank you very much. We've got time for one more quick question. Has there anybody else got a question that they'd like to ask of the panel? It's a little bit difficult to see. Yes, there's a lady at the back.
Hello, Lisa Morrison. I want to pick up a little bit on Steve's point because, yes, we've been talking about this for absolutely years, yet we're still in the same position. So with the 4 member governments on stage and the TSA, my question is, how are we going to raise public awareness? Because I think Technology Strategy Board, now Innovate UK, did a survey a couple of years ago of the public, and they said 93% of the public don't know what telecare, telemedicine, telesurveillance, whoever actually is. But 67% of them were interested in potentially having it as a service and knowing more information. So together, with the people on the stage, how are we going to raise public awareness of what TECS can actually do?
It's kind of going back to that question, isn't it? How do we communicate clearly and concisely?
From the TSA's point of view, Lisa, what I would like to see is we do understand what that message, and we talk about technology-enabled care, and as you'll know, as an associate of TSA, that technology-enabled care came from the board 2-3 years ago, and bit by bit, we've achieved. The member think tank, the members across the nation state are starting to use that terminology. But what I would like to know, is it right? Is it right so that 67% of people that would like to use those services actually understand what we're delivering? So me personally, would like that to be a key activity within the think tank and our membership to move forward and get some definition of that. What is the market message so people can access services?
Okay, thank you very much. Now we are going very quick sound bites because we're running a little bit to time now.
Well, I was just going to say, and it echoes the comments made earlier this morning about how the most common websites accessed are information sources. Yeah. And one of the big things we're doing in Scotland, and you'll have the opportunity to hear about this afternoon, under the Dallas initiative, is actually trying to address that very issue. We've got the Living It Up platform in Scotland, which is our Dallas part. And it's very much about communicating those kind of messages to members of the public. They've engaged with several thousand people across the country to get them to actually help shape what kind of technologies they want to do and how they want to access services. And in terms of how we communicate to Scotland, we've got our Digital Health and Care Week in the week beginning the 7th of December in Scotland, where at a national level we're having our own conference, but also we're encouraging all the local areas in Scotland to have public engagement events across the country. And I think that realistically, that is the only way we can do it right now, is to actually just go out there and physically meet with as many members of the public as we possibly can.
Can I just comment?
I know it, yeah, of course.
Just because I think that here is a role which I think the TSA are ideally suited for, because I've no doubt at all that consumer pull is one of the big strategies that need to be put in place. And there's no area like telecare and telehealth and other such services where you can generate real human interest stories, and the media get that. And it is something I think the TSA could play a definite role in, just in terms of positioning some of those stories in the media spotlight, not just on Twitter feeds and all that sort of thing, but, mainstream TV. I think definitely the media get it at a human level, it carries interest, and I think that will help with the consumer pull aspect. It's not something which we can do, because we're meant to be servants to all of that, but I think it's definitely something the TSA could do.
Okay. And I feel like we could kind of continue this conversation for a lot longer. There's so many things that we can discuss with you, and you probably want to raise with us. And I have some good news for you, because Alyson has very kindly given us a couple of rooms. So in your parallel sessions that are happening this afternoon, there are two. There's one running from 2 till 3, and there's one running from 3 till 4. And if today you want to choose to change your session and continue that conversation that we've started today with our panel members, there is the opportunity for you to do that. What you need to do is go to the reception where you signed in, and there will be some tickets for those conversations. We have about 20, 25 places for each group maximum. So if you do think, well, this is really, really interesting, I want to sit down and have a conversation now with that time, that's how I want to use my time, then go to reception and pick up, they have some tickets for those sessions, and they'll tell you where to go. But in the great tradition of any kind of session where we're asking you to choose something, we're going to ask our lovely panel members to remind you of some of those challenges that they've been mentioning earlier, and we're going to get them on their feet, and they're going to have less than 30 seconds to tell us the title of their session and some key things about why you should want that to kind of be the conversation goes ahead. Because those of you who are counting still after last night will know that we have 2 time slots and 3 potential sessions that should go ahead. So we're going to have a little bit of nation-state competitiveness now, as we're going to ask them to sell to you their challenge and why they think that should get a slot on the afternoon agenda. Who wants to go first?
In order.
I'll get my slot over with it.
Okay, we're going to come on. So let's stand up.
Oh,
Let's have you on your feet. We're going to.
Okay, I arrived in a bit of a rush.
Okay, so we have one we prepared earlier for you. If you want to hold that up.
Very good.
No expense spared for this morning.
Are we speaking the same language?
So why is that important? Tell us.
Well, I felt we touched upon this in the discussion earlier, really. We don't want to get into political correctness. We don't want people feeling if they're saying the wrong thing, they're going to be rebuked. They need to be able to learn. Language has to be accessible. There does have to be discipline. We need to agree the same language if we're talking about definitions. There'll be a big challenge to us in terms of standards. We have standards for services, but those standards will have to evolve to encompass technology as it changes. And clearly, we're all going to have the same definition, and that's something that I think we could agree. I'd like to think we could agree possibly across the UK administrations. But going back to the earlier point,
keep it nice and short in people's memories. We're just summing it up
are we
now.
using the same language, and are we able to communicate effectively with users, carers, and the professionals in the front line?
Are we using the same language, and are we able to communicate with the people we need to communicate with effectively? So if you want that conversation to be one that carries on into the afternoon sessions, in a moment you'll put your hands up for Steve's session. Alistair. Nice and short.
Okay, so the question is, will I be the one of the 3 that is left of the Johnny No-Mates? I'm sitting in the corner, nobody's voted for me. Sharing knowledge across the nations. Do you have the expertise that you want to offer your partners in other parts of the country? Do you want to be involved in sharing knowledge? Or do you want to stick in your own local area with your head down, buried in the sand, trying to get everything done yourself without speaking to anybody else? If the answer to that is no, then come along to this session. If the answer to that is yes, then vote for something else.
So ostriches, all collaborators, you're very welcome. That was a smart move there. And finally, we welcome Eddie, who's going to pick his final session that could go in the slot.
Well, it's a saying that every system is perfectly designed to produce the results that it produces. It's a very annoying statement. So, culture and commissioning. I have a few ideas about what I would like to do to test out with you. In fact, I have a 10-point plan about how we would address this, but I'm not going to tell you what any of the 10 points are, but I would like you to come along to the workshop and work with me on refining and developing that 10-point plan, which is action-focused. Thank you.
Okay, so we've heard from our three members of the think tank. They each have something they're really passionate about that they want to discuss with you later. I'm now going to give Paul Burstow the very tricky job of adjudicating from the audience which of those sessions should go ahead. So, Steve, stand up. If you would like to see Steve's session take place this afternoon, can we turn the lights on? Because we need to do this accurately.
Tickler. Can we turn that light down so I can see?
Can we see the audience, please?
Thank you, that's fantastic.
Okay, so if you would like Steve's session to go ahead, please put, and you can only vote once, by the way, it could get very confusing. Please put your hand up now. Okay. So there's quite a bit of interest there.
Okay. Yeah.
Alistair, whether you like his challenge or you don't, he wants you to be at his session. If you would like...
You're going to be humiliated as well.
Okay, it's hotting up.
Okay.
Very good. Oh, hang on a minute. You can't put your hand up and then put it down. That's very confusing for you. Hands up now. Hold it in the air. Thank you.
Congratulations to all the Scots who put their hand up.
We won't ask you to declare which nation you're from. And finally, Eddie, stand up. Eddie's got a 10-point plan. Do you want to know what it is? Put your hands up now. Oh, wow, I'm so glad this isn't me to decide.
Well, thank you very much for making it so easy to choose.
Thank you, Eddie.
I think, and it really is just by a whisker, that I think Eddie probably got just slightly more votes than anyone, and I think probably Steve was then second, and it was Alistair. My apologies, but that's how I see it in the room, and that's how I'm going to call it. So I hope you enjoy the two sessions that I've selected for you, and thank you for voting.
Okay, thank you very much. And just a quick reminder before we leave the stage, if you would like to go and have a conversation, all of our panel members, by the way, will be there in that conversation. And, you know, there will be opportunities to pick up on other discussions. Then go along to the reception desk where you signed in and pick up a ticket to those sessions. They are few and far between, so you'll need to make speed at lunch. Finally, can I just thank you very much for being such good sports and for joining the conversation. And we could just thank our panel members in the usual way. So thank you.